Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Amelia Binti Adam. So for this presentation, I would like to present about echolalia as functional communication for children with autism spectrum disorder or ASD. For this presentation, I was supervised by Assistant Professor Dr. Nurhanisah Binti Tukiran. So the content of my presentation will involve the introductions about this presentation, anything related to echolalia, and also the communication styles in autism children, and also the conclusion for this presentation. So for my introduction, it will involve the definition of autism spectrum disorder as well as the ASD characteristics according to DSM-5. According to the American Speech and Hearing Association 2015 or ASHA, ASD can be defined as neurodevelopmental disorder characterized by two domains. The first one is deficits in social communication and social interaction, and the second one is presence of restricted, repetitive behaviors or interests. So for the characteristics of autism spectrum disorder also will be divided into these two domains. For the social interaction and communication deficits, the first one is impairment in joint attention, impairment in social reciprocity, challenges using verbal and non-verbal communication, behaviors for social interaction. And as for repetitive, restrictive behavior and interest, the first one is repetitive speech, which we also call as echolalia, the repetitive motor movements, inflexible adherence to routines, restricted interest, hyper or hyposensitivity. And for this presentation, we will highlight about the repetitive speech or echolalia. I will explain about the definitions of echolalia and the types of echolalia. So what is echolalia? Echolalia is repeating words or phrases heard from songs, televisions, movies, or people, either right away or later. And echolalia is divided into two types. The first one is immediate echolalia, and the second one is delay echolalia. Immediate echolalia is the utterances that are repeated immediately or after a brief delay. It is from quick recall of information from the short-term memory, while delay echolalia is the utterances that are repeated after a significant delay, and it is retrieved from the long-term memory. Next, we will discuss about the communication styles in autism children. First, the interactive versus non-interactive echolalia. Second, the communicative functions that ASD children can use from echolalia. And the third is Gestalt language development. So for the interactive versus non-interactive echolalia, for the interactive echolalia, it is the repetitive utterances with communication intent. For example, requesting and commenting. For the non-interactive echolalia, it is predominantly used for play, calming down, self-regulation, and self-stimulation. Next, the example of echolalia as communicative function. The first one is to establish a routine. When autism children repeat certain phrases, it shows they know or expect what usually occur in that situation. For example, the routine involves activities such as brushing teeth. The caregiver always says, "Time to brush your teeth." Over the time, the child starts to echoing these phrases. When it's time to brush teeth, they will say, "Time to brush your teeth." The second communicative function is requesting or expressing needs. So children with autism may repeat phrases they have heard associated with certain activities or objects to communicate what they want. For example, the child frequently exposed to the Old MacDonald song such as Old MacDonald had a farm, E-I-E-I-O. On his farm he had a chicken, E-I-E-I-O. So they may use the Old MacDonald song to request for animal farm toys, such as repeating the names of the animal from the songs. For example, instead of saying, "I want chicken," the children that usually produce echolalia will say, "On his farm he had a chicken, E-I-E-I-O." So for the third communicative function is to gain attention. So ASD children may echo phrases they have heard from others to use to capture their attention. For example, a child with ASD who enjoys watching a YouTube video where the host often says, "Hey, look at this," whenever they show something interesting. Later, the child finds a fascinating butterfly, for example, in the backyard and wants to show it to their siblings. Instead of directly saying, "Look at this butterfly," the child will echo the phrases that they have heard before by saying, "Hey, look at this." And the fourth communicative function is commenting. So children with autism might repeat things they have heard to join in a conversation related to the conversation topic. For example, in a cartoon they watch, the characters often exclaim zoom zoom when driving fast. One day, while playing with their toy car, the child wants to express how fast it's going. Instead of directly commenting on the speed, for example, the car is fast, they echo the phrase they have heard from the cartoon and say zoom zoom. So next I will explain about the Gestalt language development or processing. So before we go further about the Gestalt language processing, imagine understand language is like putting puzzles together. There are two main ways our brain can do to learn language. The first one is Gestalt language processing, and the second one is analytic language processing. So the Gestalt processing is like looking the whole puzzle picture to understand it, while analytic processing is like examine each puzzle pieces carefully. So let me give further examples to differentiate between these two language processing. For example, let's take the sentence of the big brown dog is chasing the cat. So usually, Gestalt language processor might understand this sentence by picturing the whole scene in their mind. A big brown dog is chasing a cat. They grasp the overall meaning without focusing on the specific or each individual word. While analytic language processing usually will break down the sentence into smaller parts. They will focus on the each word's meaning and the grammatical structure. For example, they will try to understand the words big, describe the sizes of the dog, the brown, which is describe the color of the dog, and so on. So today we'll be talking mainly about Gestalt language processing, especially how it connects with echolalia, a common behavior seen in children with autism. We'll look into how Gestalt processing affects how the child with echolalia learn to speak and communicate. So according to ASHA 2015, the Gestalt language development is a pattern of language growth that follows expected stages, starting from using the whole phrases together and progressing to create original sentences. So according to Blank 2012, there are 6 stages of Gestalt language processing. Stage 1 is delay echolalia, which the children with autism spectrum disorder usually listen to a song or to a phrases frequently, such as the wheel on the bus goes round and round. And then for the stage 2, mix and match, which the child start to combine two echolalia. For example, the first echo is the wheel on the bus goes round and round, and the second echo is all the way to school. So the child start to combine these two echolalia, become one sentence, which is, for example, bus goes to school. For the third stage, the child start to produce single words or two words combination spontaneously by breaking down the scripts and create new combinations. For example, whenever the child see a bus, instead of echoing the phrases or the songs that they have heard before, they can actually produce it as a single word, bus, for example. Or even the child started to add a new words to describe the bus. For example, big bus, which include the adjective and also the noun. So next, moving on to the stage 4, which is the original phrases and beginning sentences. At this stage, the children with autism spectrum disorder that produce echolalia usually will use beginning grammar. For example, whenever they see a bus, they will not only produce single word, which is bus, but they start to produce long utterances. For example, that is a bus. And for the stage 5, the child starting to use their original sentence with more complex grammar. For example, I go to school by bus. For the stage 6, the children also use original sentences with a complete grammar system compared to the stage 5. For example, the bus is not coming yet. We are late to school. As for the conclusion, so echolalia serves similar purpose as regular language, like making requests or sharing information. So individuals with echolalia are tried to communicate in the same ways as other people, but they repeat the words instead of produce it spontaneously. So understand and supporting echolalia can actually help people with autism spectrum disorder to communicate effectively, such as support them by using Gestalt language processing. So these are the references that I use for this presentation, and that's all from me. Thank you.